Democrats got beat bad in the fall midterms, but now in local battles across the country, there are new signs every day that the tide is actually turning. Look, in Jacksonville, Florida, Mayor-elect Alvin Brown is the first Democrat in nearly 2 decades to win office. A Florida Times Union columnist writes that state GOP leaders are, quote, in shock. Who's to blame? Many point the finger at Republican Governor Rick Scott. In New Hampshire, Republicans crushed Democrats in the fall, taking a nearly 200-seat majority. But this week, a Democrat won a special election for a seat recently vacated by a Republican, a result local papers are calling a big upset. And a congressional race in upstate New York could be the biggest shocker of all. A district that's been Republican nearly the whole time since the Civil War could flip in next week's special election. Democrat Kathy Hochul is actually in the lead, according to one poll. And finally, remember those union-crushing bills in Ohio and Wisconsin? Well, union workers at one hospital in California are showing everyone how to fight back. They were asked to take layoffs and cuts to their pension and health benefits. Instead of accepting the cuts, they asked why the outgoing CEO of the hospital was getting a nearly $4 million payout. Now, an audit of the hospital has been ordered, and there have been no cuts yet. You see that? Victory is possible. With me now is John Borsos, Vice President of the National Union of Healthcare Workers. Part of making that victory possible, that union represents 850 workers at the Salinas Valley Memorial, the hospital where this is all playing out. Thanks so much for joining us. We really appreciate it.
We appreciate being here.
All right, so tell me about what was initially going to happen and how you guys fought it.
Yeah, the hospital came to us and proposed significant cutbacks on staff as well as pension and health care. And we began to research the hospital and found out that in the last 5 years it made $100 million in profits. And the more we dug, we found out that the CEO was making double what the President of the United States makes, 4 times what the Governor of California makes. And it turned out that he had 7 or 8 pension plans. And we began to bring public attention to that. Just as caregivers in the facility came together and united and said that if the hospital goes forward and insists on cuts, they're going to stand up and fight, including taking strike action if necessary.
I mean, look at that. They're asking you to take pension cuts while the guy's getting 7 or 8 different pensions. I don't even know how they justify that. I mean, this is also a public arena. So how is this guy getting $4 million? What's their justification?
Well, they said that it's necessary for them to remain competitive, but we're not aware of anyone else in the state who has that kind of exorbitant pension plan. And then on top of that, they've hired consultants where they're paying last year $10 million to do the same exact job that they've overpaid this gentleman and his executive team to do. So from our perspective, they seem to have a lot of money to pay for executives and consultants, but when it comes to having caregivers at the bedside, they're unavailable to take care of patients. That's where they want to scrimp and save. And we think that that's just completely inappropriate.
You know, I know a lot of businesses do this, but I think if you're paying a CEO $4 million, then he shouldn't need $10 million in consulting. He's the CEO. He should be able to figure it out for $4 million. But look, I want to talk about how you got to a point where you're at a bit of a stalemate here, how you fought back. What did you do? Did you go to the papers? How did you get this to stop in its tracks?
Well, we did a number of things. Under the California Public Records Act, we requested an amount of information to get some of these details. We began to talk to the newspapers. We began to do actions outside of the hospitals. We spent a lot of time talking to our members and educating them about what was going on at the hospital. And we began to stand up and fight. Unfortunately, the same thing that's happening in Salinas is happening at other employers in California, including Kaiser Permanente, where yesterday 2,500 NUHW members stood up and struck actually for a day to protest these kind of actions. So it's bringing caregivers together to stand up to hold public officials, executives accountable, and that's what we did at Salinas, and that's what we're doing at Kaiser Permanente as well.
And that's the whole point of unions, is to stick together. So John Borsos of the National Union of Healthcare Workers, thank you so much for joining us tonight. Really appreciate it.
Thank you very much for having me.